Preoperative marking of the shoulder is indispensable to locate the landmark which will guide our surgery. Start in 2, 1. Let's go. To perform the shoulder marking is necessary to start with the bony eminence that is easiest to palpate. Remember, some patients have a thick subcutaneous tissue which make difficult the palpation of bony eminence. So, to initiate at the posterolateral angle of the acromion, make easier the drawing. We make dots on the bony eminence, starting with the scapular spine, and then to follow with the anterior border of the clavicle, until reaching the anterolateral bony vertex. Then, it is easier to locate the lateral border of the acromion. Later, like in kindergarten, we connect the dots to completely draw the bone shape. Next, we prepare to locate the spinoclavicular angle. The Neviazer portal is described here, and it's very helpful to repair the superior labrum. Subsequently, we identify and mark the line of the AC joint. Then, we locate the coracoid process with our thumb. We use small marks to specify, based on theoretical knowledge, where the most common arthroscopic portals to be used will be located. And finally, the posterior arthroscopic portal, which it is the starting of our procedure. Now we're inside the joint. Scope is located at the posterior portal. We need to do a quick look of the joint. Check the cartilage indemnity of the humeral head and glenoid. Capsule, biceps status, biceps anchor, bicipital groove, labrum, subscapularis tendon, supraspinatus tendon, infraspinatus tendon, axillary pouch to look for loose body, and posterior labrum. All these structures must be checked during the initial diagnostic scope. Let's go into details with another patient. It is a right shoulder. We have the humeral at the right side of the view, and the glenoid to the left of the screen. We see the biceps, its anchor insertion at the superior glenoid. Next, we see the long head of biceps, into the bicipital groove. Then, subscapularis tendon, and we pulled back the humeral head to check the insertion. To assess the supraspinatus and infraspinatus tendon, we need to do the opposite and pushing forward the head. We will locate the bare area, which is normal. Then, we will go on to axillary pouch to look for loose bodies and see the inferior capsule. Next, we can see the inferior labrum and following the posterior labrum. After the diagnose, we can create our anterior portal, which it is into the anterior interval rotator. We need to locate our portal above subscapularis tendon and lateral to the cojoint tendon, which means a bit lateral to the coracoid process. After opening and dilation of the portal, we can use cannula or not. It is surgeon preference. The most important is to create an easy access to the joint for our basic instruments as shaver blade and radiofrequency electrode. This anterior portal is mandatory for all shoulder arthroscopy procedures. So, it is quite important to make it properly and to be familiar with it. Ready? Let's work.